Hi guys, it is X. Welcome back to my channel. Thank you for watching and spending 10 minutes of your time with me today. On today's video, we are going to be talking about what other job opportunities you have as a nurse. If you want to become a nurse or thinking about it, it's a perfect video for you to understand what types of jobs are in your scope of practice. So before you swipe me away or click me out of this video, please like, comment, and don't forget to hit the subscribe button. Idea was actually given to me by a friend, and I will put her name down below, and thank you so much for the video idea. But so the reason why I wanted to make this video was because a lot of people I've heard want to become nurses but don't exactly like know what you can do or know what fields are out there. I actually recently just had a person who I was taking care of their family member, and they said, oh, I'm in nursing school. And I was like, cool, that's awesome. Like, what kind of nurse do you want to be? And they said a cath lab nurse. And I was like a little taken back, like, wait, what? Cath lab? Like, I mean, nothing's wrong with cath lab, but it's just not something you hear, especially from people who don't really know the field. Like, that is just something that I'm a little shocked to hear, because usually people say like ER or ICU or labor and delivery, peds, like those are more common things that you hear when you ask people like what type of nurse they want to be when they're in nursing school. But cath lab, I don't even know if people like know what that is coming into nursing school unless you work with people that work in cath lab or know someone that works in cath lab. So I was just a little shocked. So I kind of want to go over different like places in the hospital you can work as well as outside of the work, and this is mainly for people who have a fear of needles, have a fear of blood, or feel like bodily fluids is just something that you can't handle. I definitely have mentioned in another video that when you're in the hospital, your mindset completely changes and you kind of forget about that. Like, I was the type of person that if I heard somebody throw up, I would immediately throw up. Like, I would start gagging. And I'm now the person that it's like, oh my God, the patient's throwing up. Like, I stick my hands out with my gloves because I don't want you to dirty my sheets. Like, it's so funny how things like that have changed for me personally. And there are patients sometimes who say like, oh my God, I'm so sorry you have to clean up my poop. And I'm like, oh, it doesn't faze me. Like, I do this every day. Like, I don't even think about it like that. And another story that I have for you is one time I was a nursing student and I was working at Starbucks, and my coworker was carrying a crate and her belly button ring got ripped off, and I started screaming. I was like, and she's like, what, you're a nursing student, like why is this freaking you out? And I'm like, yeah, but I have a navel ring, and that just like the thought of my navel ring being yanked out, like, oh my God, that's just so scary to me. And then later on that same day, literally went to clinical, and I was assisting a neurosurgeon in placing an EVD. And at the time, I have never placed an EVD before, but I asked him like, are you making burr holes? And he literally looked at me and was like, oh my God, where did you train? Like, and I'm like, no, this isn't something I learned in nursing school. It literally was from something I watched on Grey's Anatomy. It was the episode with Katherine Heigl, and there was like the boat crash, and she had to like drill burr holes into somebody's brain in order to relieve pressure while they were on the boat because they couldn't get to him. And I just like laughed because I'm like, I literally learned this on Grey's Anatomy. It had nothing to do with schooling. But yeah, so that day I was assisting the neurosurgeon, and it was the exact same day that this happened to my coworker, and he had asked me if I could help clean up the patient's hair. Like, there was bone, skull, like brain matter in her hair. Her family was gonna come in, so please, like, can you help me clean it out? And I was like, yeah, sure. And I'm literally there detangling the hair, cleaning it all up, and I just start giggling. And the nurse was like, why are you laughing? And I said, because earlier today my coworker's belly button ring got ripped out, and I was there screaming, and here I am in the hospital cleaning brain matter out of someone's hair like nothing's going on. I said, it's just so funny how your mindset definitely changes once you're in practice. Another thing that happened to me was I was in Starbucks one time, and this person, I was in a like not a bad neighborhood, but just not a bad good area. Like, we always had people overdose. We always found needles and syringes in our bathrooms. So I had gotten a customer who came to me and said, hey, I've been waiting for the bathroom for like 20 minutes. Nobody's answering. I started freaking out because I'm like, oh no, like, I hope this person's okay. So I started banging on the door. nothing, like didn't hear anything, couldn't get the door open. I called the police because I'm like, I don't want to walk in on this person and like not have them on the phone, or if like somebody needs an ambulance, like I should have the police on the phone. So I finally unlocked the door and went in, and some guy was in the women's restroom completely naked from head to toe, and I was like, oh my god. Like I shut the door and I'm like, I'm so sorry, and I told the police like, I'm fine, I don't need the ambulance, like they're awake. And then I see people naked all the time. Like I bathe my patients on a daily basis, and when I'm in the hospital, that doesn't faze me. I don't even think about, you know, oh, this person is naked, like these are their genitals or anything like that. Like you don't think about that stuff in the hospital. It's your job. But when you're at Starbucks and you walk in on somebody naked and you don't expect it, it's like, whoa. Like, so that is something I just want to express to you, that you will get used to seeing things and doing things and smelling things that you think you're not okay with, but once you're in practice, like it's totally different mindset. Like you don't think about those things anymore. So I'm gonna go ahead and start off, and I apologize, this isn't gonna, for the sake of the length of this video, I'm gonna talk a little bit about everything that I have kind of written down, but just know that there are other jobs out there that I might not mention, and I don't get offended if I forget your specialty. However, there is a lot of things that you can do as a nurse, and I don't know much about all these places because I've only worked in the hospital, but I am going to briefly kind of go over things that I know about. So one of them is jail. You can be a prison nurse. You give out medications. You work in the jail system, and there's security around you. I have personally taken care of inmates at the hospital, but this is something that you can actually be on site at the facility of the jail or prison. Next is a school nurse. So when I actually was getting my bachelor's degree, I had my nurse I went to at school, and she told me that it would be a good idea for me to get my bachelor's and become a school nurse because the pay was great, and she said the schedule was awesome because if you worked at like high school or elementary school, like you work exactly the same months as the school system, so you'll have your summers off. The next thing you can do is work at a clinic. I'm not sure exactly what level of nursing they hire. So there are licensed vocational nurses, and then there's registered nurses. So I'm not sure if a clinic is more aimed at a licensed vocational nurse, but I'm sure there are clinics out there who do hire nurses, registered nurses. You can work in laser hair removal. You do have to be, I believe, a nurse to do that. You can work in skincare, and quickly cosmetics. So there are nurses who I went to school with who specifically didn't want to become nurses just to take care of people. Like they wanted to become nurses so they can get Botox and stuff. So they became registered nurses for that reason. So that is definitely something that you can do. I believe there are nurses who do injections, like the, what is it called for the butt injections? Sculptra, I believe it's Sculptra. Let me see, every single disease process. So you can literally work specifically in neuro, cardiac, respiratory, liver, kidney, like there's many different types of units, ortho. So there, especially like transplantation, stuff like that. So sometimes there's designated like kidney floors where people need, my cat is attacking me. I'm sorry, Cookie, stop. So there is like kidney floors that do dialysis. They do, hold on. Okay, sorry. Like I was saying, so there are dialysis floors, like kidney patients that need dialysis, or peritoneal dialysis. There are certain nurses that can do that. And then if you don't like patient care, direct patient care, there's also case management. And these are the people that kind of set up the transfers from hospital to outside facilities. They also like set up, I believe, like the oxygen tanks that they need, or this might be social work. I'm not exactly sure, but I know case management deals a lot with like insurance and placement and stuff like that. CEO. So there are nurses who are like chief nursing officers in the hospital. I believe there are nurses who are like, I don't want to say CEOs, but like in higher positions in the hospital. There's also hospice and palliative nurses. And for those of you that don't know, there is a difference between hospice and palliative. Hospice is more like when you have 6 months to live, they want to keep you comfortable and stuff like that. Palliative is more like you have a chronic disease. It doesn't mean that it's terminal. It's just a chronic disease, and they focus on pain management and focusing on keeping you comfortable. And then, like I said before, there's dialysis nurses. So there are many different types of dialysis nurses. Sometimes there's dialysis nurses that are in-house. There's something called CRRT, which is continuous renal replacement therapy. And for that, I've seen nurses who actually work on the unit be trained on that, and they can do that. And then for other dialysis nurses, you can either go to a dialysis center, outpatient, or there's nurses that come to the hospitals to dialyze patients. And then radiation. So whenever somebody has cancer, there are radiation facilities. These cats won't let me film today. I apologize. So like I said, there's radiation nurses who you go to their, little facility, and they will measure and do all the radiation stuff. And then there are, I also want to mention, since we're on cancer, I have it written down, other infusion nurses. So the infusion nurses are I want to say there are 2 types, but I'm sure there's multiple. I've also gotten to rotate to an infusion center where it was more like chemotherapy. So this is outpatient. Patients will come, they'll spend 4 to 8 hours sitting there while they get their chemo. And then recently, I think something that's become popular is stuff like home infusions, where they come and they hook you up and they give you boluses of saline and vitamins if you don't feel good. And then there are military jobs, so you can be in the military and be a nurse. I've seen and trained with Navy nurses all the time at my previous job. So there's cath lab. Cath lab is whenever somebody has a heart attack, they go in and just to check, they'll go into the femoral, and then they'll go up into the heart and see what kind of blockages there are. There's teaching jobs, so either you can be a teacher and teach other nursing students in the classroom, or you can be a clinical instructor where you go to the hospital with the nursing students and you just oversee them and watch them. There's CRNA, which is a nurse anesthetist. So those are basically going to be nurses that that put patients to sleep during surgery or any other type of procedure, endoscopies or popping somebody's, shoulder into place in the ER. So I'm pretty sure there's more of a scope of practice there, but I'm not too familiar with it. You can work in a nursing home. So I know usually nursing homes probably will have 1 or 2 registered nurses, and then they have their LVNs, and then they'll have their CNAs. So you can work in a nursing home. You can be a nurse practitioner, and there's many different types of nurse practitioners, whether you want to work in family nurse practice, adult gerontology, acute care, pediatrics, and many other, I believe ER. There are just a lot of different types. And if you don't know what a nurse practitioner is, it's a physician's assistant, where you can prescribe medication and basically treat your own patients under the supervision of a doctor. And then there's nursing informatics, or IT. I don't know too much about that field, but I do remember at my first job we had a nurse and we all had iPhones, and so the iPhones were allowed us to keep in contact with the patients' families. They allowed us to, whenever the call light would go on, it would go directly to our phone, or if we had to call a doctor, we all had our own iPhones. And whenever they weren't working, this nurse who worked for our informatics IT team would come, and he would see what was wrong with the phone and fix them. And then there's parish nurses. So those nurses, I believe, specifically work for churches, and they're more faith-based types of nursing. There's a nurse midwife, which is I don't want to say maybe a doula. They go and assist you and make a plan for you to give birth. And then there's offices. Like I said, once again, doctor's offices. I'm not sure if they hire registered nurses or if they're licensed vocational nurses, but you can work at a doctor's office who does cosmetic surgery or outpatient cardiac stuff, or what else, GI, stuff like that. And then ships, there's cruise ships. I believe there's cruise ships that are long that they have nurses on just in case anybody on the ship gets sick. And then medical missions, I've wanted to do one of these so badly, but just haven't had the time. So hopefully one day I will get to. But basically, if you sign up for a medical mission, I don't think all of them are paid. I want to say that they're usually volunteer, but some of them do pay you, and you basically, like when Hurricane Harvey hit, I had signed up to go to Texas to assist with that. I know a coworker that just recently got to go to, was it Puerto Rico and Florida, like when the last major hurricane hit. And then there are other places that you can go to, third world countries, and help and assist and treat those patients. Oh, so I talked about cosmetics and Botox. So hospital, basically there are many different places in the hospital that you can work, whether it's med surg, tele, ICU, ER, DOU, like rehab, or behavioral health, which is more for, in psychiatric, so they're basically the same thing. And then let me see, I'm trying to remember what else in the hospital there is, because there's just so many different jobs that you can literally do. And you can also literally work with any age group. You can work with babies, you can work and it also with any age group, you can work with any acuity level, and I'll explain what that is in a second. So with age group, you can either work with babies, children, adolescents, like geriatric patients, adult patients, sometimes those are mixed. And then acuity level, I will kind of explain that briefly, is like you have your stable patients, which are sometimes like going to be on a med surg floor or a tele floor. So tele is more like an intermediate care, and then you can work in like a step down observation unit, and then critical care. So there are just many different levels. If whatever you feel comfortable with working in those levels. There's some people who don't like to work in high acuity places like the ICU because they feel either intimidated or scared, or they like being, you know, in a lower acuity. And I personally, as an ICU nurse, don't like to work in lower acuity because I get scared. Like, I honestly, it's so funny because I've had med surg nurses tell me, like, I don't know how you work in the ICU, it's so scary. And I'm like, I don't know how you work in med surg, I think it's scary. Like, in the ICU, I have all these toys, like I have monitors, I have all these pumps, like I can see everything that's going on. And whenever I float to like a tele unit or something like that, like I get palpitations because I'm like, I don't have my monitors, I don't have the comfort of seeing my vitals all the time. Like, it literally will scare me because I'm like, I go and like check them more than once an hour because I'm like, what if something happens and I can't see? In the ICU, I can see everything. So yeah, you can just work in any different type of acuity. And then let me see, management. There obviously you have managers who are nurses who oversee you, directors, administration, human resources, home health. So home health, these nurses will go to your house and they will take care of you, take care of your meds, and they'll probably see you a couple times a week and stuff like that. And then one thing I wanted to piggyback off home health, what was I gonna say? Hopefully I can remember and come back. Oh, wound care, that's what I was gonna say. You can also have a wound care nurse, which I am pretty like interested in. So I like wounds. So basically if people have pressure ulcers, and you don't like need to be in the hospital, there are some really bad pressure ulcers out there. These nurses will go to the homes a couple times a week and redress the dressings and help you heal it at home. Flight nursing, so I'm not talking about flight nursing like you're on a flight and there's a nurse there. I'm talking about like when people are in motor vehicle accidents or at a lower acuity hospital that need to go to a higher level of care. There are helicopters that come and pick these patients up. My dream is to go to the helipad one day. Like, I just really want to see like the patient come in the helicopter. I always get so excited when I hear it. There's operating room nurse. So they, I don't know what a nurse circulator does. Like, I always try to ask. I feel like they kind of run the flow in the OR, but I don't know. There's also an RN first assist, and they are the ones that help and assist the doctor. And then there is rehab. So there are many different types of rehabs. There's chemical rehab, and then there's physical rehab. So chemical rehab would be for patients, obviously, who have like a chemical dependence, addiction and stuff like that. And then there's physical rehab, where if you had an injury or like a heart attack and you kind of have to get a nurse back to health or stuff like that. And let me see, One Legacy. So One Legacy is an organ donation company, and basically whenever somebody agrees to donate their organs, these nurses will come kind of take over, manage the care, and then a nurse that works at the hospital will assist them and conduct out the orders that the nurse provides. Then there's the Red Cross. I do have a friend who works at the Red Cross. I'm not exactly sure what she does, but I know that she does like, I think the little interview before you do get your blood donated and stuff like that. And I don't know too much else about it, but I do know that they hire nurses for the Red Cross. And then public health, there are nurses and many other types of jobs out there in public health, out in the public. And when my grandpa had passed away, his longtime pastor at our church that we went to as a kid had actually asked me, like, hey, once you get your bachelor's, we have a homeless program here, like, if you want to come run it. And I was like, whoa, like, I don't know, like, I was still like only a year into my career, and he was like offering me this job, and I'm like, I don't know if I want to do that. That's a lot of responsibility. But there are a lot of different public health nursing jobs out there. Don't know too many of them, so I can't speak about them. And then burns. So there are a couple of hospitals that have actual burn units, and I got to go to the burn unit floor once, and what these nurses do is just crazy. Like, all the things that to dress and redress and take care of these patients and make sure that they don't have infections and stuff like that. I don't know, it was just an insane experience when I was there. So I hope you get a better understanding of different jobs that are out there that you can have as a nurse. List down below if I forgot anything, or if you're a nurse and you're watching this video, please tell me what specialty you're in, I guess how long you've worked in it, and what you love about your job. And I think that's gonna be it for this video. I'm trying to remember if there's like anything else at the moment that I can recall, but I think that's gonna be it. So thank you guys for watching, and have a lovely day. Bye.